Hi there. Today I'm going to show you a couple specific skills that we call resourcing skills. These are excellent skills that help individuals to calm down and to just kind of tune into themselves in a healthy way that allows them to specifically respond to triggers when they come rather than reacting to them. And so I'm just going to show you a few specific things that you can do when you do get triggered by, say, maybe a trauma or something that reminds you of a trauma or a specific smell or a memory or a situation in the past or the present or even something that you're thinking about in the future. So these are just a couple specific things that I show people when they come in to see me, and these are all based on specific mechanisms that we have in the body. Just like we get a cut and heal just kind of naturally, we're designed with specific ways to regulate and to take care of ourselves that are within our body. And so I'm just going to show you a few ways that you can do that. One of the first things to talk about is just the importance of the breath. And so if nobody's ever taught you how to breathe effectively towards healthy change and healthy regulation of emotions, I'm just going to show you how to do that today. And it's very simple. All you need to do is figure out the difference between chest breathing and belly breathing. Chest breathing is when your chest is going up and down pretty rapidly. It's like this is what you might feel after like running or something like that, or when you feel anxiety. Oftentimes it's in your chest, and usually the breaths are a little shorter. But what we want to focus on is belly breathing, which is specifically from the diaphragm. So what I want you to do is focus on your belly and breathing in so that your belly expands. Breathe in through your nose and out through your mouth. You should be able to see your hands move up and down. In through your nose and hold, and out through your mouth. Try that one more time. So I want you to try this one more time, usually 4 or 5 times. When you breathe in this way, it sends a signal to the brain to relax. It helps you to know that things are okay, and maybe if they don't feel okay, it just sends a signal to the brain, hey, I see you. It's okay that things don't feel that great right now. So that's one thing, and what I want you to do as I teach you these specific skills is pair these skills with that deep belly breathing, breathing in through your nose and out through your mouth. So the first thing that I want to show you is something called acupressure, and I'm going to show you a few different ways that you can do this. But the most easy and simple way to do acupressure is to take your hand, your right hand or your left hand, and kind of make a sandwich with your thumb and your middle finger and your index finger, and just find that area between your thumb and your pointer finger and just squeeze and massage that area as you take those deep breaths. You can sit back a little bit and just practice massaging that area. This is another natural mechanism that we have that sends a signal to the brain to relax. You might feel a bit of a washing over your body as you feel this. Just notice where you feel that as you do that. You can try switching to the other side and see if that is any different, or if one side is more responsive to the other. This is called acupressure. A lot of people with migraines use this as just a small tool to help them to downregulate a little bit, sending those relaxing signals to the brain. This isn't a cure, this is just something to help. Pair it with that breathing. The nice thing about this is you could be sitting somewhere or having lunch or with a friend even, and nobody would really know the difference that you're doing this acupressure. And you might be able to even tell from my voice that I'm beginning to feel downregulated, that this is relaxing me. And so, oh, I'm getting a phone call. I'm going to let it go, though, because we're focusing on downregulating and letting go of the things that are bothering us. We can let go. We don't necessarily have to figure them out. We can just sit with them, and that's the whole point. We're not trying to figure anything out. We're just trying to sit with it. So that's acupressure. I'm going to show you one other thing in this video, and this one is a little less, it's definitely visible, and so what I want you to do, we're going to find another point in the body that provides that same kind of calm. And so what I want you to do is make a butterfly or a Batman or whatever you want to call it, and I want to see if you can find with your middle fingers, there's these two spots underneath the clavicles. So here's your shoulders, here's your collarbone. I'm wearing a sweater, so you can't see this very well, and then here's your sternum. So right where those meet, you should be able to find two small indents. They're not really holes, they're just indents. So you see how I'm just massaging those two indents? If you're above your clavicle, then you're probably not in the right place. It's just below it where your shoulder ends and your sternum starts. So massaging this and breathing is just another way to downregulate. Now, another thing that you can do, and some people find this even more effective, is just to alternate tapping on these small holes right here, just like this. 1, 2, and breathe. Not too fast. This is just another thing that sends signals to the brain that things are okay. It doesn't need to figure everything out. And that you see its pain, and that you're there. This is step 1 to being your own friend within this process. And it's a challenge, but just learning to sit with these things is the first step, and it's so important to practice this. So what I want you to do this week is just practice the acupressure, and I want you to practice these bilateral taps or the massaging, something to do before bed or just when you find yourself stressed or triggered, and to pair it with those deep belly breaths. If you want to make sure you're doing it right, just put your hand on your stomach and see if it rises. Just like that. So those are just a few things to start with. I'll continue to make some videos and provide a couple different ways that you can downregulate and use these resources effectively.